As you know, diabetes is one of the leading causes of kidney disease. Many patients have both, right? Kidney disease and diabetes, so they're living with two chronic illnesses. Can you talk about some of those challenges of somebody that would have both kidney disease and diabetes?
It's complicated, and I've been working behind the scenes trying to uncomplicate that as best I can, but the best way I could describe it is someone's already dealing with a chronic illness, right? They're already dealing with diabetes, and like I mentioned earlier, it's a constant, you're constantly thinking about it. It's constantly in your mind, you're constantly on that, you're constantly balancing it, right? You're on that teeter-totter, balancing it out. So when people come to us and they're already trying to manage their diabetes and then they suddenly have kidney problems or dialysis, they get this extra level, right? This extra layer of burden, if you will. And unfortunately, one affects the other. So if your diabetes can cause the kidney failure, which we do see, unfortunately. I think the stats are like 40 to 50%, depending on which stats you look at, of dialysis patients have diabetes, unfortunately. What I see when people come to us with diabetes, what we hear all the time is, well, what can I eat? All right, so we have a dietitian on our team because of that. We have a team of people. It's not just, we teach them how to do their treatment. We help guide them through the complicated path.
As a PD nurse who is living with diabetes, I would imagine that this gives you a unique insight into the challenges that a diabetic kidney patient might face.
Yeah, I think it makes me relate a little more. Not that I have kidney failure, but the risk is always there, given that I'm diabetic and have been for almost 30 years. And you know, I know the stats, so the chances of me having kidney failure are higher. So, you know, I've got that piece that I can relate. And I can relate to the mental exhaustion and the burden of always thinking about it. And, you know, you add on this extra layer, you know, whether they're diabetic or not, there's just that extra level of burden and fear and doubt. So there's a lot of levels. It's not just you have kidney failure or kidney issues and here, do this treatment, or here, take this medicine. There's so many layers to it in terms of accepting it or not accepting it, and you know, how do you navigate every aspect of it while having a tube in your body and having suddenly a bunch of supplies at your home potentially if you're doing PD, or you know, there's like you unearth lots of levels. It affects couples, right? You know, you've got someone who was very active and now they're not very active anymore because they've got so much fatigue from the kidney disease and anemia and whatnot. And the other person isn't maybe recognizing that they look okay. They don't look like they're tired or unwell, but they're telling them, I'm really tired. So I've seen, you know, sometimes arguments between couples even, where it's like, well, he just sits around. It's like, well, yeah, because he's really ill actually at this moment, but we're working on it. So yeah, it's not even just the person, it's the family members, it's the caregivers, it's the kids, whoever is involved. They all have their own fears and doubts and worries as well. And so a lot of what we do isn't just teaching someone how to do their treatment, it's navigating how it's gonna work in their real life. Not just, here, you need to do this, this is the prescription, and go. It's a lot of helping them figure out what their new normal is for that time.